The number of Canadians to die from the H1N1 flu virus rose today to 8. Health officials in Saskatchewan revealed 2 children were among 3 victims in that province. The strain has also claimed 5 lives in Alberta. As Kim Brunhuber reports, the deadly virus is marching eastwards, prompting calls for more Canadians to get vaccinated.
We're asking people to come back and vote now because there's not even room for waiting right now.
It's not panic exactly, not yet, but today's block-long lineup for a flu shot, a sign of just how seriously these people are taking the outbreak.
In the past, we typically haven't gotten the shot, but this year I've just been hearing and reading that there's a few more aggressive types of strains.
This year's dominant strain, H1N1, the same virus involved in the deaths of more than 400 people in 2009.
We are beginning to see increasing strain on the healthcare system that has the potential to escalate.
In Alberta and Saskatchewan, more than 1,000 confirmed cases associated with H1N1, and they expect the numbers to keep rising among the groups most vulnerable to the virus.
Children, less than 5, who've not seen that strain before, and young adults are going to be more affected by the flu this year.
So, do I have to worry? That's what many Canadians are now asking themselves.
So, how worried should we be about this?
The answer depends largely on what antibodies you acquired since the H1N1 virus first appeared in 2009.
Now 4 years has gone by, more and more of us have some sort of immunity against H1N1, either because we've had it before or because we've been getting the vaccine.
But if you haven't had the flu or the shot, for you, this is 2009.
The real ironic thing is the group that's most likely to get bad disease from this are also the ones who tend not to get vaccinated.
Saskatchewan and Alberta are planning mass vaccination clinics, but for this outbreak, it may actually be too late.
The sad thing is that it takes another 2 weeks for those antibodies to kick in. It's not clear how much help it's going to be to them. They really should have gotten it in November.
Public health officials say you should still get vaccinated because there could be a second flu peak in March, and it's definitely not too late for those who live in parts of the country that haven't yet been hit. Doctors warn the same outbreak that's hitting the West is almost certain to make its way east. Kim Brunhuber, CBC News, Toronto.
Kim mentioned in his report how mass flu vaccine clinics are opening up across Alberta to combat the H1N1 virus. The province's health minister says they are urgently needed. Only 21% of people in that province have had a flu shot. That compares to 44% of Canadians who have either already been immunized or say they intend on having the shot this winter.